Have you ever wondered what goes into the assessment and treatment of trauma patients? In the world of medicine, trauma care stands as a complex and intricate field, demanding both swift action and keen discernment. Imagine a clock ticking, each second crucial, as medical professionals engage in a race against time, striving to stabilize a trauma patient. The pressure is immense, yet they remain calm and focused, their extensive training guiding them through each step. Central to trauma care is the initial assessment of the patient. This is where the patient's life-threatening injuries are identified, and immediate treatment begins. It's a critical juncture, a juncture that calls for the ability to make quick yet informed decisions. Following the initial assessment comes the detailed examination, also known as the secondary survey. This stage enables the identification of less obvious injuries, which, though not immediately life-threatening, require attention. It's a systematic, thorough process ensuring no injury goes unnoticed. Formulating a treatment plan might seem straightforward, but when it comes to trauma care, it's anything but. Each patient is unique, each injury distinct, and thus, each treatment plan must be tailored accordingly. It's a process that demands a deep understanding of medicine and a keen eye for detail. Yet, even with the most comprehensive treatment plan, success in trauma care hinges on effective teamwork. The ability of the medical team to work in unison, each member playing a critical role, is paramount. It's a dance, a harmonious blend of skills and knowledge, all aimed at one goal: saving lives. And the learning never stops. In trauma care, continual learning and improvement are not just ideals, they are necessities. With each patient, each case, medical professionals gain new insights, refining their skills and expanding their knowledge. So, you see, the assessment and treatment of trauma patients require a blend of quick thinking, medical knowledge, and practical skills. It's an intricate dance, a delicate balance, and a testament to the remarkable capabilities of those who dedicate their lives to this field. The initial assessment of a trauma patient follows the ABCDE approach. This approach is a mnemonic that guides healthcare professionals in the immediate assessment and treatment of critically ill or injured patients. It stands for airway, breathing, circulation, disability, and exposure. Let's break down each component. First, we have airway. This is the starting point. We must ensure the patient's airway is clear. Any blockage can be a matter of life or death. If the patient can talk and respond, their airway is likely clear. If not, we might need to intervene using techniques from simple repositioning to more complex procedures like intubation. Next comes breathing. Here we assess the patient's respiratory rate and oxygen levels. We're looking for signs of distress, like rapid breathing or bluish skin. We also listen to the chest to identify any abnormal sounds. Early recognition of breathing problems can prevent a patient from deteriorating. The third step is circulation. We check the patient's heart rate and blood pressure to evaluate their circulatory status. We also observe the skin, as paleness or coolness can indicate poor circulation. Rapid treatment of circulatory issues can significantly improve a patient's outcome. Following circulation is disability. This stage involves a quick evaluation of the patient's neurological status. We assess the level of consciousness and check for any signs of disability. We might use tools like the Glasgow Coma Scale to gauge the patient's responsiveness. Early identification of neurological issues can guide further treatment. Finally, we have exposure. This means we remove the patient's clothing to check for any hidden injuries. It's crucial to maintain the patient's dignity and warmth during this process. It's the last step, but certainly not the least important. Each step of the ABCDE approach is crucial in stabilizing the patient and identifying potential life-threatening conditions. It acts as a systematic, sequential assessment that ensures no aspect of a patient's condition is overlooked. Remember, the ABCDE approach is a vital tool in the initial evaluation of a trauma patient. After the initial assessment, a detailed examination or secondary survey is conducted. This process is much like a detective's work, meticulously combing through the clues, in this case, the patient's body, to understand the full extent of the trauma. The secondary survey is a systematic head-to-toe examination. It begins at the top, with the head and neck, checking for signs of injury through visual inspection and palpation. This includes looking for signs of skull fractures, facial injuries, or neck instability. Next, the chest and abdomen are examined. Here we're looking for injuries that may affect the patient's breathing or circulation. We check for chest wall stability and signs of internal bleeding. We also listen to the lung and heart sounds, and palpate the abdomen to detect any tenderness or rigidity. Moving on, we examine the pelvis and extremities, checking for fractures, dislocations, or other injuries that might pose a threat to the patient's mobility or circulation. Throughout this process, it's crucial to continually reassess the ABCDEs, the patient's airway, breathing, circulation, disability, and exposure. This is because the patient's condition can change rapidly, and it's vital to catch these changes early to prevent further deterioration. In addition to the physical examination, the secondary survey may also involve the use of diagnostic tools. For instance, X-rays can be used to visualize fractures, while CT scans can help identify internal injuries. Finally, the secondary survey includes a detailed history taking, where we gather more information about the patient's medical history, the nature of the trauma, and any symptoms they're experiencing. This information is invaluable in piecing together the puzzle and understanding the full picture of the patient's condition. To sum it up, the secondary survey is an essential step in trauma care. It's a thorough and systematic examination that ensures no stone is left unturned, no injury overlooked. By identifying all injuries and understanding their severity, we can formulate a comprehensive and effective treatment plan. The secondary survey ensures no injuries are overlooked and helps in formulating a treatment plan. Once the patient is stable and all injuries are identified, a treatment plan is formulated. Now, this isn't a process carried out in a vacuum. It's a dynamic procedure that takes into account a myriad of factors, all of which contribute to the optimal recovery of the patient. First and foremost, the severity and type of injuries play a crucial role in shaping the treatment plan. A mild concussion will require a different approach than, say, a fractured femur. Similarly, a puncture wound needs a distinct treatment protocol compared to a burn injury. Each injury type has its own unique set of challenges and corresponding solutions. Then, we consider the patient's overall health. A patient with robust health and no pre-existing conditions may recover quicker and handle more aggressive treatments. On the other hand, a patient with, let's say, diabetes or heart disease may need a more cautious approach. Age, too, plays a vital role. Younger patients generally have a greater capacity for recovery, while older patients may need more time and support. Available resources are another critical factor. The medical facilities, the expertise of the healthcare team, the availability of certain medications or equipment, all of these can influence the treatment plan. It's about making the most of what you have to provide the best possible care. But let's not forget about pain management and psychological support. These are often overlooked but are just as important. Pain management not only improves the patient's comfort, but can also speed up recovery. Psychological support, on the other hand, can help patients cope with the emotional and mental stress that often accompanies trauma. So you see, formulating a treatment plan is a complex task that requires a deep understanding of the patient's condition, a keen eye for detail, and a high degree of flexibility. It's like solving a puzzle, where each piece must fit perfectly to create the complete picture. A well-thought-out treatment plan is critical for the patient's recovery, so let's ensure we give it the attention and care it deserves. In trauma care, teamwork makes the dream work. Isn't that a catchy phrase? But it's not just a cool quote. It's a fundamental truth. The importance of teamwork in trauma care cannot be overstated. When we're dealing with life and death situations, every second counts. And it's during these high-pressure moments that effective communication and seamless coordination among the trauma team can mean the difference between a patient's recovery or deterioration. Imagine a well-oiled machine, where each part plays a crucial role in the overall function. That's what a trauma team should be like. Every member, from the trauma surgeon to the nurses, radiologists, anesthesiologists, and even the cleaning staff, has a unique and vital role to play. The trauma surgeon, often seen as the conductor of this intricate symphony, provides decisive leadership and makes crucial decisions about the patient's care. But they don't do it alone. They rely on the expertise and input of their team. Nurses, the backbone of any medical team, handle a multitude of tasks, from administering medications to monitoring vitals and providing comfort to the patient. They're the eyes and ears on the ground, often being the first to notice any changes in the patient's condition. Radiologists provide crucial information about the patient's internal injuries, giving the team a window into what can't be seen from the outside. Anesthesiologists ensure the patient's pain is managed and that they are stable during any procedures. And let's not forget the cleaning staff, who ensure a sterile environment, helping to prevent infections and further complications. In essence, effective trauma care is like a dance where everyone knows their steps and moves in harmony. It's about understanding and respecting each other's roles, communicating effectively, and working towards the common goal of saving a life. And so we come to understand that the role of teamwork in trauma care is not just about working together, but about working together effectively. It's about understanding that every role is important, every task matters, and every second counts. A cohesive trauma team can literally be the difference between life and death. In the world of trauma care, there is always room for learning and improvement. This statement rings true in every corner of the medical field, but perhaps most poignantly in the high-stakes, time-sensitive arena of trauma care. Why is continual learning so crucial? Well, consider this. Medical science is a field that never stops evolving. Every day, new studies are conducted, new findings are published, and new guidelines are established. Staying updated with this wealth of information is not just a matter of professional dedication, it's a matter of life and death. It's the difference between delivering good care and delivering exceptional care. But it's not just about staying abreast of the latest research. It's also about refining your skills, honing your instincts, and expanding your knowledge through hands-on experience. Each patient, each case, is a unique puzzle with its own set of challenges, and each one offers a valuable opportunity for learning and growth. Think of it like this. Every time you encounter a new trauma case, you're stepping into an intense, real-time classroom. The stakes are high, the pressure is on, and the lessons you learn could be pivotal in saving a life. And just like in any classroom, the more focused and engaged you are, the more you'll learn. Training, too, is a vital component of continual improvement. Whether it's attending workshops, participating in simulations, or engaging in peer-to-peer learning, training provides a safe and controlled environment to practice, make mistakes, and learn from them without the risk of real-world consequences. In the end, the goal of continual learning and improvement is not just to become better at what you do. It's to become the best trauma care provider you can be, capable of handling any emergency with confidence, skill, and compassion. It's about striving for excellence, not just for your own professional satisfaction, but for the benefit of the patients who depend on you. With each case, a trauma care provider becomes more equipped to handle future emergencies. The journey may be challenging, but the rewards, both personal and professional, are truly priceless. Now, let's quickly revisit the key points we discussed today. We began our journey into the fascinating world of trauma care by acknowledging its intricacies. Trauma care is a complex and dynamic field that requires a unique blend of knowledge, skills, and attitudes. It is not just about knowing the anatomy and physiology of the human body, but also about understanding the psychology of trauma patients and their families, the social and economic implications of trauma, and the legal and ethical issues surrounding trauma care. We then moved on to the initial assessment of trauma patients. We underscored the importance of the ABCDE approach: airway, breathing, circulation, disability, and exposure. This systematic method of assessment ensures that life-threatening conditions are identified and addressed promptly. It is the cornerstone of trauma care, and mastering it is essential for every trauma care provider. Next, we delved into the detailed examination and secondary survey. This step involves a thorough head-to-toe examination and the collection of a detailed history. It aims to identify injuries that may not be immediately life-threatening, but could become so if not treated in a timely manner. We also discussed formulating a treatment plan. We emphasized that every trauma patient is unique, and so should be their treatment plan. The plan should be based on the patient's injuries, their overall health status, and their personal preferences. It should also take into account the resources available and the expertise of the treating team. The role of teamwork in trauma care was our next point of discussion. We highlighted that trauma care is a team sport. It requires the coordinated efforts of a multidisciplinary team that includes doctors, nurses, paramedics, radiographers, and others. The team should work together seamlessly, with clear communication, mutual respect, and a shared goal of providing the best possible care for the patient. Our final point was about continual learning and improvement. We stressed that in the rapidly evolving field of trauma care, learning should never stop. It is a lifelong journey of acquiring new knowledge and skills, reflecting on our experiences, and striving to do better. In sum, trauma care is a challenging yet rewarding field. It tests our knowledge, skills, and attitudes to the limit, but it also provides us with the opportunity to make a real difference in people's lives. Remember, mastering trauma patient assessment and treatment is a journey, not a destination. So let's keep learning, keep improving, and keep making a difference.